Today we will be discussing about autosomal dominant inheritance. It is determined by the presence of one abnormal gene on one of the autosome. We usually have a pair of autosome. उसमें से अगर एक allele भी जो है वो mutated होगी, the disease will be affecting the person. And if we talk about what are autosomes, any chromosomes apart from sex chromosomes are autosome. Human usually have 22 pairs of chromosome and उसमें से additional जो होता है वो one pair of sex chromosome होता है. Autosomal disorders are manifested in heterozygous state. Over here, we can see a Punnett square in which there is a parent without trait and a parent with trait. The parent with the trait is having two alleles in which one of that is mutated, so the parent will be manifesting the disease. But over here, there are two small d's, both alleles are fine. Now there will be a crossover for the children. So for the crossover, what we will be doing, we will be taking one allele from here and one from here and one from here and one from here, and we will be doing the crossover. Over here we can see that this allele is inherited by these two children, and both of the children are affected. But over here the crossover is done one allele from here and one from here, one from here and one from here. So both the children are without the trait because they both have the normal alleles. There is a point to be remembered that both male and females are affected and can transmit the condition. So this is called a vertical transmission of the autosomal dominant. Autosomal dominant disorders are further characterized by three different things. सबसे पहली जो चीज़ होती है वो ये होती है that is it is not important that the patient have to be affected. Sometimes there होता है कि हमारे पास जो some proportion of patients are their parents are not affected but the disease is present in the offsprings. कुछ कंडीशंस में लाइक इन हंटिंगटन डिजीज़ द एज ऑफ ऑनसेट इज़ डिलेड. जो हमारे पास साइंस एंड सिम्टम्स होते हैं हमारे पास जो है वो बहुत लेट एक्सप्रेस होते हैं. एंड द थर्ड इज़ वेरिएशन इन पेनिट्रेंस एंड एक्सप्रेसिविटी. व्हाट इज़ penetrance and expressivity? If we talk about penetrance जो है it refers to the proportion of the people with particular genetic mutation exhibiting symptoms of a particular genetic disorders. Sometimes हमारे पास क्या होता है कि इनकम्प्लीट पेनिट्रेंस होती है ड्यू टू विच हमारे पास जो म्यूटेटेड जीन के प्रेजेंट होते हुए भी जो डिजीज़ है दैट इज़ नॉट फुली डेवलप्ड और अफेक्टिंग द पेशेंट. And if we talk about expressivity is the degree to which phenotype is expressed by the individual having particular genotype. For example, there is example of Marfan syndrome. What happens in Marfan syndrome in some patient, that in Marfan syndrome there are three different things that can happen. That are, they can be in ocular changes, there can be skeletal abnormalities and cardiovascular lesion. But it is not necessary that the patient having a Marfan syndrome would exhibit all these three abnormalities. Either in some patient there can be cardiovascular lesion, and for example they will be maybe having a valve prolapse but not ocular changes or skeletal abnormalities. But in some patient it might be present only skeletal abnormalities and ocular changes but no cardiovascular lesions. So that is what we call expressivity of the degree in the patient in autosomal dominant. Here we are having some autosomal dominant examples for which there's a mnemonic that is called heavy dominant. From H we have Huntington disease, E Ehlers-Danlos syndrome, A achondroplasia, V von Willebrand disease, Y for polycystic kidney, D for dystrophia myotonica, O osteogenesis imperfecta, M for Marfan syndrome, I for intermittent porphyria, N for neurofibromatosis, A for achondroplasia, and T for tuberous sclerosis. Another Punnett square is given over here that is of Huntington alleles, in which we can see there is a mother and a father, and the Huntington alleles is present in the mother, that is the capital H. So हमारे पास जो है when we will be crossing over, these two children will be having the capital H allele, due to which they both will be affected and both will be not, and two of them will not be affected. The pedigree shown over here is of autosomal dominant. If we talk about how do I know that this pedigree is of the autosomal dominant, let me tell you. First we will be seeing the key. In the key it is shown that the squares are denoting the male and the circles are denoting the female. जो हमारे पास मेल हैं that the red ones are affected, the blue ones are not affected, same as the females. So the crossing over is done, in which we are having 5 children of these both parents, 1, 2, 3, 4 and 5. we can see that there is no carrier state in this pedigree. All are either affected or are not affected. So we are having 1 affected, 2 affected, and 3 affected, and the 2 are normal. So from this we can say that that this pedigree is of autosomal dominant.